Governor Phil Murphy, thank you so much for being with us on ITV Gold. How are you doing today, and how is your team doing?
Listen, Aditi, we're holding up. It's good to be back with you. We're holding up, but these are as tough a period of time as this state has ever seen. We've got almost 9,000 deceased due to COVID-19. Other numbers are looking a lot better. Hospitalizations are down, ICU beds, ventilator use. We look at heat maps by county. That's all looking better, but we're losing people still. These are folks who were, infected some number of weeks ago, so we were prepared for that.
Right.
God willing, we're getting there. The compliance up and down New Jersey, folks staying at home, social distancing, putting masks on, washing their hands. We've been the #1 state in America for pushing that curve down, and I'm incredibly grateful for that. We just got to keep it up a while longer.
Definitely. Governor Murphy, would you please address, those people that have lost loved ones? I know even the South Asian American community, we've even lost doctors, in New Jersey, and they've done some incredible work. Just a word for the ones that are grieving.
Yeah, I mean, I speak every day to a handful of people who have lost loved ones. I just literally finished up making several calls. As you can imagine, they can get very emotional. The South Asian community has paid a big price. I spoke with a mom yesterday who lost she herself a doctor, lost her husband and daughter, and she has 2 other daughters, and they're also doctors, so 5 doctors in that family, and dad and daughter are gone. And the part that's really, in addition to the loss, which is bad enough, obviously, the nature of this virus is that you can't be with your loved one in their final days,
Yes.
and then you can't do a proper memorial or funeral service for them afterwards. So there's a feeling as though that it's not only a horrible loss, it's an incomplete horrible loss. And I would just say to each and every one of these folks, God bless you. You're in our prayers. Your loved ones will never be forgotten. And we are with you in solidarity.
Are there any facilities particularly being provided by the state for these families?
Well, it depends on who it is, obviously, and it does get down to the individual circumstances. So you've got the whole range of folks. I am concerned that our communities that are historically left behind, the communities that have less access to health care, that have disproportionate social determinants of health, which are not healthy, disproportionately congregated in small spaces, living spaces, disproportionately represented among our essential workers, invariably communities of color and immigrant communities. I'm very concerned that this virus has ripped open that reality as if we didn't know it already. And we're committed to making sure that we address that properly going forward.
If I was to ask you what the future of healthcare looks like for the rest of the year, in terms of patient caring, in terms of predicting what's going to happen for the next few months, what would you have to say?
Keep in mind that I'm not a medical expert, so I will give you my best judgment based on the inputs that we get. I think I'll give you the most, I'd say optimistic, but it's also realistic. It's achievable curve that I see. So we're in early May. I see the balance of May are the curves that we're watching carefully, the data that we're watching carefully, slowly but surely continuing to improve. I see further baby steps in opening up our state again. We opened up county and state parks last weekend.
Yes.
I hope we'll be able to continue to open pieces of the state up responsibly. I think we can have a steady summer, and I say steady, but it will be a new normal. So I think it'll still be a while before people are congregating inside of places. I think our healthcare system will get back to some level. It's still at a very high level of activity. There's still 4,000 something patients in hospitals from COVID-19 right now as I speak with you. 307 something people went into the hospitals yesterday with COVID-19. So I see that getting to a more stable place. And I think the other piece of this, Aditi, is that folks the medical experts would suggest that we may have some therapeutics that are specific for COVID-19 as early potentially as next fall. That would be a big deal. And then a year plus from now, which is optimistic, but you may well have a world where we've got a vaccine that's both safe and scalable. So that's a curve that may be optimistic, but I think it's within a realistic, attainable future over the next year.
Governor Murphy, for the community that's asking straight question about what is your take on reopening, when do you predict New Jersey to be in this new normal that everyone keeps on discussing about? What would you say to that?
I think it'll be incremental. We have a 6-point plan to get back to recovery. 4 of those markers are healthcare. So the curve's coming down, scaling up testing, contact tracing, isolation plans, and then economic recovery and resiliency. Our big mantra is public health creates economic health.
Right.
And that data determines dates. Those are 2 very important guidelines, guiding concepts for us. But I think we'll be able to continue to take some steps over the next number of weeks. I hope we'll have some semblance of some sort of normalcy on the shore this summer. So I'd say it's a matter of weeks, but even when we get there, it will be, as you rightfully point out, a new normal. It will not be going all the way back to where we were 6 months ago. It'll be a different normal, but it will be a more open state than we are now, without question.
Could you reflect on this communication we keep on hearing between you and Governor Andrew Cuomo, and also just the tri-state in general? All of you have taken a stand in, coming up with these phases for reopening. Could you reflect a little bit more into that?
Yeah, it's a good question. Again, so there's really sort of 3 rings of responsibility. The most important is, in my capacity as Chief Executive Officer of the state of New Jersey, is to look out for the welfare of the safety of the 9 million of us who call this great state their home, and to save as many lives as possible. The second ring is regional coordination. We coordinated actively with our neighbors, especially New York, as we closed the state. We're doing the same as we consider steps to reopen. That doesn't mean we'll take lockstep the same steps, but we will coordinate, harmonize. We actually put a more of a formality around it. We have a regional council of 7 states. And then thirdly, we coordinate, and there's no way around it, we coordinate and find common ground with the federal government. And that is also an active endeavor on our part. The federal government can play an existential role that no one else can play, and it's our job and my job to make sure we maximize that relationship. The regional coordination has gone really well, and I want to give a shout out to my neighboring governors, Governor Cuomo, especially of New York, but Governor Wolf of Pennsylvania, Carney of Delaware, Lamont of Connecticut. We've had an enormous amount of exchanges and partnership in this whole process.
I have one quick question. Do you think that the proximity to New York City, or New York City in general, is the reason why we have so many cases in the state of Jersey? It is the second highest right now in the country.
Yeah, there's no question. I mean, we are part of the metro New York City reality, and we have people who, hundreds of thousands of people who go in and out, or used to go in and out of New York City every day. Right. Our airports. There's no question. And when you look at the counties in our state that have been most impacted both by tests and fatalities, it's the 6 biggest commuting counties: Bergen, Hudson, Essex, Union, Passaic, Middlesex. Those are the 6 that send the most amount of people in and out of New York every day. And those are the counties that suffered first and have suffered the most.
Oh, wow. Governor Murphy, you said in a tweet that we need expansive and direct federal funding for states to help support heroes getting us through COVID. This was a call out for police, EMS, healthcare workers, everyone on the front lines, to educators. Could you reflect on why, this call was so important? And this federal aid, how much do we need here for the state of New Jersey, and who needs it the most?
Yeah, I'll start with the last part of your question. We need 20 or more billion dollars in New Jersey alone. in direct state cash assistance from the federal government. And there are some out there that would lead you to believe that that's to help us manage with our so-called legacy costs or pension challenges. And that's just not true. I got elected to fix the economy, fix state government. We had made enormous progress in that respect. Still a long way to go, but we have a plan for that. Here's what we don't have a plan for. We didn't have a plan for a pandemic, which has crushed us. It's both our expenses are skyrocketing, taking care of folks who are sick or have lost a job, or small businesses that have been crushed, and so on. And at the same time, our revenues have fallen off a cliff. And so in the absence of direct federal cash assistance, it's putting the livelihoods at stake of the very people that we need right now in this once in not just a generation or century. This is the biggest healthcare crisis in our country's and our state's history. We need firefighters, police, EMS, educators, healthcare workers at the point of attack. We can't afford to lay them off, but that's what will happen if we don't get federal cash assistance. So I'm still hopeful we're going to get a big slug out of Congress, and it's not just blue states; it's both blue and red. We need help, and I hope to God it's coming.
How has your communication been with President Trump?
It's been very good. I mean, we're obviously not in the same party. We don't agree. There's a whole long list of things we probably don't agree on, but to his credit, and I think to our credit, we have checked our partisan ship at the door, and we've found a lot of common ground in terms of, with tangible results: ventilators, bed capacity,
Right.
Personal protective equipment, support for our hospital systems, personal protective equipment, not just generally, but specifically lately to the long-term care facilities,
Right.
testing. So I will say I am grateful for the common ground that we've found and the support that we've gotten.
Definitely, and that's good to hear that there's so much communication between state and federal entities. That has been kind of relieving for a lot of community members. In terms of economic crisis, I have to ask you one question. A lot of South Asian families are worried about the impact this economy crisis has had on small businesses. And there are so many, thousands and thousands of South Asians own small businesses in the state of New Jersey. What can they, look forward to in terms of relief efforts, and perhaps a message out to them?
Yeah, listen, the South Asian community, which is so essential to our state's well-being and one of our biggest and fastest growing, it has a disproportionate, and you and I have talked about this before, a disproportionate representation in our small business community. And they've been crushed. There's just no other way to put it. So we've put forward, I think, principally through the Economic Development Authority, a really good set of grants and loans. The problem is there's overwhelming demand. The supply demand for that scarce amount of capital is overwhelming. I'm hoping we'll be able to take further steps in the state as well, so stay tuned for that. But the big source of potential help, the folks who can print money, we can't do that, is the federal government. And getting more support out of the federal government directly into the small business sector is a huge priority for us. And again, like direct state cash assistance, the small business help is something we're going to continue to pound away on with our congressional delegation and at national levels.
Another topic that's really concerning South Asian viewers of ITV Gold, or I can say parents of this country, is the education system. It's the impact COVID has had on learning in general and the access to it. How are you as a governor ensuring that each child of this state gets access to education, has resources? And what do you have to say about this impact COVID has had on the education system?
Yeah, listen, we're not just any state as it relates to education. We have the #1 public education system in America.
Yes.
And we fought hard to get there with great educators, great kids, great parents, great administrators. And so we've gone remote learning now for going on 2 months, and that will be the case for the balance of the school year. And I think for the most part, we've done it really well. And I know that only by comparison with anecdotal stories I hear all the time relative to other states. but we clearly haven't, in baseball terms, forgive me for that, we have not batted 1,000. So we clearly can do better, particularly with underserved communities that won't have access as readily to a device, for instance. And so I know the Commissioner of Education, Dr. Lamont Repillette, and his team are wargaming right now. What are the lessons learned? What does the summer potentially look like for enrichment and opportunities? By the way, what do camps look like this summer? And also, what is back to school look like in the fall? We've got to get that far out ahead in our planning. So it's a constant review and iterative process. Again, we start with a crown jewel of our state, the best public schools in the country. We want to keep it that way.
Definitely. I have you for less than a minute right now, Governor Murphy. I have to ask you, the next few weeks are going to be so important for us to see what the next phase of coronavirus pandemic is. What is your focus right now, and what should all our viewers watching you at ITV Post should know?
Yeah, I'd say the focus, great question. And again, I appreciate it, Aditi. I would say, number one, we're still putting the fire out. So top priority is public health. And with that, when we achieve that, we create economic health. It's got to be in that order. And it's not without pain. The pain is overwhelming of the amount of folks who are unemployed, who are frustrated that they still haven't gotten through yet. The small businesses you talked about. You can look the healthcare workers who are heroically running in every single day to save lives. We've got to stabilize our public health system. Secondly, second priority is to have the infrastructure in place where not only we feel confident, but folks who live in New Jersey feel confident that they can get back to some kind of normalcy. That's the testing, rapid return, scaled up, contact tracing. You test positive, God forbid, we know exactly who you come in contact with. We can isolate you and prevent this from flaring up again. And then thirdly, not just waiting until then, because we'll take more steps in the next few weeks, but then to be able to gradually, responsibly open things up. Again, not back to the old normal, but to some semblance of a new normal. Yes. And I'd say those are the sort of the three priorities in order that we're dealing with right now.
Here's to a positive new normal. And I really, truly thank you for your service to the state of New Jersey and to your office. I know you're working hard every single day without any rest. Thank you again. Thanks so much for your time on ITV Gold.
Thank you for having me on ITV Gold. It's great to see you again and give your parents my best wishes. And I hope that we'll get back to that new normal sooner than later, and we'll get you back into New Jersey.
Yes, definitely. Thank you.